Hello, everybody. Good afternoon, and welcome to today's Nutrition Education Echo Clinic. We'll go ahead and start the session, and if somebody joins later on, they can. But let's try and be on time. We have two cases to discuss today. We have Jill and Veronica who will be reviewing their cases. And then we have Carmela's didactics to get to. So we'll start today's sessions with introductions. My name is Neha Sharma, and I'm the program coordinator for Project Echo Nevada. Carmela?
Carmela Thomas, registered dietitian and certified diabetes care and education specialist with UNR Med.
Thanks, Carmela. Dr. Lavi couldn't join us today because of another commitment he has, but he'll be here for the next session. So we'll go out to all of you who are joining us. Veronica, can you introduce yourself, please?
Hello, my name is Veronica. I currently work for Quest Diagnostics. I have my bachelor's in health and wellness, minored in psychology, and I have a certification in community health worker.
Veronica. Jill?
Hi, I'm Jill Elliott. I'm a registered nurse and a community health worker. I work for Carson Tahoe Behavioral Outpatient Services, and I'm in Minden, Nevada.
Thanks, Jill. Rosa?
Hi everyone, I'm Rosa and I'm a medical assistant and community health worker. I work here in Las Vegas and Nevada Health Centers.
Thanks, Rosa. Jane?
Hold on. There you go. Hi, I'm Jane. I work with veterans, social worker, work with veterans in a transitional housing program here in Las Vegas.
Awesome. Thank you, everybody, for introducing yourselves. We will go on to the case review. First, we will do Veronica, your case, and then we will do Jill's case. So I will pull up Veronica's first. Okay. There you go, Veronica.
So the patient that I was working with, she wants to know how she can exercise since she broke her hip, her foot, and her shoulder back in September, December. It was different times when she broke them, but she wants to do something, but she's afraid since she's had multiple breaks. She's 67. She's not Hispanic. She's a white female. 70 inches is her height. She weighs 180 pounds. BMI is 25.8. She has type 2 diabetes. She's had it for over 10 years. She does have a family history. Her last A1C was 5.6 back in January 29th. There's no known complications to diabetes. Her last diabetic foot exam was December 21st, 2020. Her last eye exam was November 9th, 2020. She's on Novolog 3 times a day. She does check her glucose 3 times a day. In the morning, she's usually about 120. She doesn't have episodes of hypoglycemia. Her last cholesterol check was 12/21/2020. She's not on any cholesterol meds. She has had all of her vaccines or immunizations. Does the client exercise? She wants to, but she's afraid again because of breaking her hip, her foot, and her shoulder back in September and December. She eats an average of 3 meals. She eats at home. She tries to stay away from sweets. But she does like sugar. She does have sugar-free ice cream sometimes, and she likes candy corn. She has no preferences. She does her own shopping. And there's no barriers to eating or anything or health.
Okay, thank you so much, Veronica. We will now move on to the clarifying questions. Any questions from the group to understand the case a little better?
This is Jill. I would like to know what she was doing before for exercise.
She really wasn't doing anything, but she walks. She would do some walking every day, not much. But now she's like afraid to do anything at all.
Hi,
I
this
have
is
a,
Jane. Oh, sorry.
go ahead, Jane, go ahead.
Okay, thanks, Rosa. I was wondering if the fact is, if she's consulted with her doctor about walking or doing some type of exercise that won't be problematic to her current conditions?
That I don't know.
My question, Veronica, I don't know, I think I missed it. Maybe you mentioned it. She's concerning that she's gaining weight or that she's not just exercise as a health?
Just that she's not exercising.
Okay.
Any other questions?
This is Jill. How did she break everything?
She was getting out of the car and tripped over the curb. So that was one incident. And then another incident was the stairs at her house. And she doesn't want to use a walker. So, I mean, that creates another barrier challenge for her.
Veronica, this is Jane. I had another question since Jill mentioned that. Is she still mobile at this time, or is she, I mean, you said that she doesn't want to use a walker, but does her doctor recommend that she use a walker?
She has one.
But she's able to get along around without one.
Mhm.
Okay. What about using, you said her shoulder, and what else is broke? I'm sorry.
She had broke her shoulder, her hip, and her foot.
Shoulder, hip, and foot. Okay. Okay. Thanks.
Any other questions for Veronica?
This is Jill again. I was wondering if she's ever been diagnosed with like low blood pressure. It sounded like she hasn't had the low blood sugar, but I'm concerned because she seems like she's got a healthy BMI and she's had these stack 2 or 3 accidents in a row. Is this unusual for her to have these type of incidences?
She said it was the first time that happened. She's never broken anything other than September and December. You know, it could have been just being careless or moving too fast. But she didn't mention that she has any thing with her blood pressure.
Okay, Carmela, any questions from your side?
Great case, Veronica. Thanks for bringing this today. I did have a couple of questions. So one was, does she live with anybody?
No, she lives alone.
Mm-hmm. Okay. And then has she been fully released by the doctor to exercise?
That I don't know if she's been released. I mean, she looks good. She's moving along good. It doesn't even actually look like she's broke anything, like she's walking, you know, fine. She's not with any limp or anything like that. So I don't know if she's been released from the doctor or anything.
Does she express any pain still by chance?
Mm-mm.
No.
No.
And then as far as her diet, did she give you any idea on like kind of some of the food choices that she eats? I heard, you know, she enjoys sweets and she tries to make good choices with that, but I'm just thinking of things like dairy rich foods. If she's doing any of those, do you have any idea by chance?
No, she only mentioned the sugar-free ice cream and the candy corn that she likes.
Okay.
But it seems like she does it in moderately, you know, not over excessively. So,
Right. Has she had any weight changes recently?
mm-mm.
She didn't gain weight over the duration of like her healing from these broken bones? Okay. Okay. Did she need surgery for her hip?
Mm-mm.
Okay. Or her shoulder or her foot? No surgeries.
Surgery.
Okay. Okay. Great. You said that she mentioned that she's afraid of falling again, right? Did she happen to express where that fear is coming from? I mean, of course, she's fallen and, there's probably some fear behind that, but has she given you any more information about, does she feel off balance? Does she feel like she can't react to catch herself, or anything about the fear behind falling?
No, she just said she has a fear because, she broke them so closely together. So my recommendation was maybe she could do something seated and,
Mhm.
something standing,
Yeah.
because she'd have more stability, that way.
Mhm. Mhm.
She just wanted to know what she can do because she's deathly afraid, because of that. So,
Yeah, totally understandable. I think I would be afraid too, for sure. And that's a great suggestion. I was kind of thinking the same thing. So we can go to recommendations now if anybody doesn't have any other questions. Those are mine. Thank you, Veronica.
you're welcome.
Carmela, do you want to summarize the case?
Oh, yeah. Yep, sorry. Okay, so we have a 67-year-old female who's at a healthy weight of 180 pounds. She has type 2 diabetes for more than 10 years with really good control over her blood sugars. Her most recent A1C was 5.6%. She's currently on one insulin, which she takes Novolog 3 times a day. She checks her blood sugars. I think the main question for this person is, after having a shoulder, hip, and foot break, she is afraid that she will fall again because two separate falls led to these breaks. And so how do we help this person with exercises when she's fearful of falling again? Legitimately could happen. So
Yeah, thanks, Carmela.
Mhm.
Veronica, does that sound all right? Do you want to add or delete anything?
That's correct.
Okay. Last chance for clarifying questions. Any other questions before we move to recommendations? Great. So we'll move to recommendations now. Any recommendations from you guys?
This is Jane. The only thing I was thinking, the same thing, was what Veronica said about the chair. I mean, she would be seated. She would be in a situation of, wouldn't have to worry about falls and what have you. So that's the only thing I was thinking of.
I think I would encourage her to use the walker and start little by little until she feels secure herself first, not just to go off like that. Just do like a little steps, starting probably do 10 minutes just so she can feel confident herself.
This is Jill. I kind of agree with, she needs to gain confidence more than probably strength or anything else. So I was thinking along the lines of physical therapy. Maybe there's some exercises out there that might help gain her confidence and help her be more stable.
Great, thanks. Any other recommendations?
I was getting ready to ask if there was any physical therapy recommendations and what have you, but Jill already covered that.
Okay, Carmela, any recommendations from you?
Yes. So I'll share with you guys. I was trying to type it in, so we'll send this, of course. But Dr. Levy did get a chance to review both Jill and Veronica, your guys' cases, and so he did provide some feedback, which was great, because I also have some patients who are in situations like this, and I mean, I can only imagine her fear, right? Breaking bones is scary. At her age, could be very harmful to her quality of life. Whether you need surgery or not, sometimes, especially when I hear hips, are big deals. So I didn't know about this program, but Dr. Levy had mentioned because she has this fear of falling, she might benefit from a class called Matter of Balance. So it's an evidence-based class that can help people overcome some fears that they have with prior falls. And apparently the program helps participants to gain confidence in viewing falls as controllable, setting goals of increasing activity, and then making changes to reduce their fall risk. So a lot of also, I think what we heard from many people with Jane's recommendations and Rosa and Jill's, you know, some of the same kind of things we were thinking. And I guess there are some providers in Nevada, and so we can send this as well to you, but there's a couple of people in Gardnerville and then Henderson, overall Vegas and Reno of providers who offer this evidence-based program, again, Matter of Balance, that can help in just, you know, gaining that confidence and helping to support her, which I thought was super cool. So we'll send that to you. But again, my plan was just to Google Matter of Balance, MATTER of Balance. So kind of cool. But I was kind of thinking the same thing. I mean, this person, just to reiterate what I think we're hearing from many of us, is that she wants to increase her exercise, it sounds like, and it's her fear that's maybe getting in the way. And so helping her with that part of it probably makes the most sense, right? Whether it's an incorporation of a program like this, or getting physical therapy, which I also think is a great suggestion, or helping her with chair exercises. And there are many out there. I know YouTube has some free ones out there, which you always got to be, of course, careful with. But also the Sanford Center for Aging at UNR, they also have a couple of classes as well. One is called Fit and Strong. And so we'll send that link as well to you, so you have that. But that would be another one. I know they don't always have the classes available. They kind of do them in groupings, but there are some chair exercises involved in that and supportive. So couple of options just to kind of think about. The other thought was, you know, helping her to do things in the home that maybe she feels safer doing too. You know, if she can't jump into some of these programs right away, walking in place and side to side are great things to do. Again, if she doesn't have anything around her and she can try to be safe with that, would be good. So I think those were my recommendations, just kind of reiterating what everybody else is doing for sure. The only last thought that I have is, and I didn't get to ask this, Veronica, but did she happen to express any like similar situations with having I know you said she didn't have a low blood sugar, or she doesn't have low blood sugars, but she is on a short acting insulin. And I'm thinking to myself, for people who are on short acting insulin, sometimes that can increase the risk of feeling lightheaded or dizzy, kind of going along with what Jill was mentioning with her blood pressure. She didn't view any similarities of her falls, or?
She didn't say anything about her blood pressure. And she didn't mention anything about being dizzy, because I was like, well, what happened, you know, before you fell, or did you realize anything? And she just said it just happened like that. So I didn't really realize anything.
Gotcha. Okay, thank you.
Thanks, guys, for all your recommendations. Carmela, I think you have already summarized all the recommendations, I guess. So we will type out all these things and send it to you, Veronica, probably tomorrow. I'll send all the recommendations to you. Any other final recommendations to add? Nothing comes to your mind?
This is Jill again. I just have one thing that comes to mind dealing with people that have diabetes and the peripheral neuropathy. It does cause balance issues because the nerves of the foot are essentially dying off, so they don't have as much balance. So that's what could be causing her balance issue were contributing to it. So that's where the foot exams are really important, and making sure if there is a treatment for the peripheral neuropathy that she's getting that.
Awesome. Thank you so much, Jill. Any other last recommendations before we move on to Jill's case? Okay, so I'll pull up Jill's now. Just give me a second here. Okay, Jill, you can start with your main question.
Okay, I just want to say thank you, Veronica. That was a great case. So you presented it very well. I'll start out. My question is, what is the best way to encourage healthy eating habits and teach someone how to manage their diabetes if they have cognitive impairment and live alone? How do we keep it simple and with regards to her treatment? She's a 54-year-old Caucasian woman. She is 62 inches and she weighs 287 pounds. So her BMI is 52.5. She has type 2 diabetes. I will have to say, I apologize. There's some holes in my data collecting here because I'm relaying this through her team and I wasn't able to get a hold of her. So I don't know how long she's had diabetes. I'm imagining it's a while. And I don't know if there's a history of diabetes or what her A1C was, but I do know that she, within the last week or so, she went to her primary care and had all her labs done, which I didn't have access to. So as far as complications from diabetes, I don't know exactly. I know she does have very high blood pressure, but that could be related not necessarily to diabetes. I don't think she's had any heart attacks or strokes or any retinopathy yet. Her last foot exam was on February 10th, and that was because she had an infected foot. I don't know her last eye exam. As far as her medications go, she takes metformin, 1,000 milligrams, and Lantus, 22 units at bedtime. And when she went to her primary care just last week, they switched it up so many times that it was so confusing that the nurse was trying to clarify and just left her where she was at right before the holiday weekend because it was getting too complicated. So that's kind of an issue. She does not monitor her glucose. That's a little too much for her she can give herself the injection, like she dials it up and she can give herself the injection as long as it's the same. But as far as like monitoring her glucose and changing the dose based on a scale, that's just not going to happen at this point. No signs of hypoglycemia. She did have a cholesterol check in January. She is on a statin cholesterol medicine. Immunizations, I would say they probably are up to date because she does have a current primary care that she goes to, but I really don't know for sure. As far as exercise, she gets out and about, and she's really hard to kind of track down, but she doesn't really get intentional exercise. She is ambulatory, but depends on oxygen. She has chronic lung disease, COPD, hypertension, congestive heart failure, and schizophrenia. And that's where we think the cognitive impairment comes from, but it could be a developmental delay. We're not really sure. She is a smoker and she lives alone with limited resources. I don't know how many meals a day she gets, but I know she gets some meals delivered to her, hot meals. So I did try to call her 4 times, didn't reach her. She's one that sometimes to find her, we have to track her down in the community. She's not moving real fast, so we kind of know where where to find her. But as far as the phone, she just has a landline. So I know she has some hot meals delivered. I think when she does eat out, she prefers fast food, and it's probably more financial thing than anything. She can go to the store and buy some stuff, but to carry it back, it would just be small and limited. She doesn't have much money. She does get disability. Her barriers to healthy eating, I put our financial. I almost put social family because she lives alone. So that's almost a barrier. But I wasn't sure, because when I thought of social family, I thought of it's more like when you live with somebody as opposed to when you don't. So she does have a hard time accessing the fresh foods, and there is some prevalence of fast food. And let's see, as far as barriers to healthy eating, cognitive, let's see, the client has cognitive difficulty and her outpatient team has not been successful in teaching her how to administer at-home blood glucose monitoring. So her doctor is managing her diabetes without home blood glucose monitoring. They do check her A1C. According to her team's nurse, she's taking oral metformin and Lantus insulin, which is in the process of being changed to other, I believe, long-acting insulins. It's just a matter of clarifying that. She was most recently seen by her primary care doctor for a foot wound, which is being treated. It's pretty bad. She has to be on antibiotics. And I would have thought it would have slowed her down, like meaning it would have been easier to find her in her apartment, but not her. So she's had recent lab work from her primary care, and I wasn't able to get it because it's in a different system, different hospital system. I know that in addition to her affected foot, she has severe hypertension, and they have increased her meds for this, her oral meds. That's my case.
Thank you, Jill. Any clarifying questions to understand the case better?
I have a question, probably I didn't hear well. Did she live alone?
Yes, she lives alone. So her main support, she has supports throughout the community. And she's got the support of, I'm sorry, I meant to tell you she's with the Assertive Community Treatment Team, which is like an outpatient psychiatric behavioral health type of team. They have case management, they have a nurse, they have counseling, and transportation. They can provide some transportation and just help with services. So that's a major source of her support. She does have a brother, but he's doing his own thing. He's not too far away though.
So with the team, does she meet with them like daily or weekly, or how does that work?
At least the team usually tracks her down once or twice a week. They'll either meet her in her home or bring her in for an appointment. But it's usually like home-based type of services or in her front yard. If because of COVID, it's a little better to be outside as long as the weather is cooperating.
Jill, I had a question. I wanted to know, the fact is with the wound care situation, do you know if I mean, obviously her current doctor is treating it, if it's severe enough that she will be referred to a wound care specialist?
She has been referred to wound care. I think at this point, this is fairly new. So I imagine within the next week, they'll have an appointment for her, or somebody will have looked at it besides her primary care and the nurses on our team.
And the other question I had, I know sometimes psychotropic meds are in a situation of having people gain weight and what have you. And is she on any current meds that are problematic to her weight?
Yes. So yes and yes. Yeah, she has to take meds for schizophrenia. I think one of them is Latuda. I'm not sure how weight gaining that one is, but that one, I'm not looking at her file right now, but I remember looking for those types of things. So that's definitely been a contributing factor.
I have a question. So does she have, you know how they have home health aides that come in? I guess, does she have accessibility to have someone to come in to help her with that, with monitoring her glucose and things like that?
That's a good question. We haven't explored that, and the team hasn't explored anything like any services like that for her, but I think it would be a matter of if we could find somebody who would be willing to do that. Team had to go in and really clean out her apartment at one point. There was bed bugs. people didn't want to come over. She's not always, she's a sweet lady, totally sweet lady. It's fun to talk to her, but she's not always appropriate. I think she was washing her feet in the sink at one of her appointments. And even though she's got access to an apartment with a shower. And so that's a good, I definitely will bring that up if we could find somebody who would be willing to do that with her.
Great questions. Any other clarifying questions? Carmela?
Awesome, thank you. I agree. Great questions. And Jill, great case. Thanks for bringing it in for us today. So you haven't chatted with her, right? Because this is fairly new to you. Is that right? You've not talked to her in the past?
I have talked to her in the past, but I didn't chat with her in the last 2 weeks.
Gotcha.
It's been 3 weeks since I've talked with her.
Okay. Oh
And
yeah.
she's not my actual I'm not the one doing her team, but we work all together. So
Mhm.
I'm not her actual nurse, but I've chatted with her in the past.
Gotcha. Does she express any desire to want to change her eating habits? I'm curious just to kind of see, or in regards to her weight or her overall health, do you have a sense of, it being a few weeks kind of in the past, at least what she's kind of expressed for what she wants to make changes with?
I don't know if I never asked her if she wants to make changes. She has no problem telling you what she's been eating.
Mhm.
So she's not trying to hide anything. So I think there is open communication and there's a strong enough rapport with the team that that could be a motivating factor.
Yeah, that's what I was wondering, maybe to kind of see if so hard when, we see things that could be areas of improvement for some people and then they're not maybe on the same page with that. Because now she's got this wound infection, and she's definitely got a lot that she's working with. But yeah, I wonder, where she's at and what makes her feel her best and what makes her be able to do the things that she wants to do. So, okay. And then you had mentioned that they might change her medications, right? But you're just not clear about that. Yeah.
They did change them. It was confusing. And because it was confusing for us healthcare providers, we picked them up from the pharmacy and usually she has a pill box set up. And
Mhm.
we added the blood pressure medicine because her blood pressure was kind of scary high. And we just left the diabetes insulin and we added the antibiotics. But because it was so confusing, we're just like, we really need clarification. We didn't get that clarification before the holiday and they were going to check in on it this morning.
Mm-hmm. Yeah, it makes it hard when someone's got that cognitive impairment to even remember to take one medication, right? Let alone, yeah. And then, so has she always lived alone, or in the past has she lived in any other situation?
That's a good question. I don't really know how she's lived in the past.
Yeah, and does she like living alone? I'm thinking to myself, she's out and about a lot. Is she lonely? Is it something that she wants to do, live by herself, or does she maybe prefer some type of group home in a way? Or I don't know, just some thoughts I have on, what does she want? What does she prefer?
I don't know what she'd prefer, but I think I look at it more as what other people would prefer. And I don't know that she doesn't make an ideal roommate. And so
Yeah.
maybe that's why it's better in some respect. I mean, her brother doesn't, when she was going through the bed bug thing, he didn't really want much to do. We were even trying to get him to help out just like one day so that we could get her place clean and just get her out and then get her back in. And he was even just didn't really want much to do about that.
Mm-hmm. Yeah, that's a tough situation for sure. For
Mhm.
sure. Has she been increasing her weight? Has her weight gone up recently, or is she kind of stable? Do you know?
I think she's pretty stable. I
Mm-hmm.
don't think this is a big change. I think as long as we've had her, which is since maybe 6 months, she's been pretty stable.
Nice. Okay. Any idea on what she's drinking throughout the day?
That's a great question. I don't know I know some of our diabetics really like their soda. I
Yeah.
don't know that she's one of those. I know she likes coffee,
Uh-huh.
and I think she's more into that. I don't know if I don't really think she's one of our big culprits of the soda, but I know we have some of the people in our program that have the whatever kind of serious mental illness, and they take the psychotropics, which cause all the weight gain, and they can't give up their sodas.
Yeah. Yeah.
That's a real issue.
Yeah, for sure, for sure. And then does she have resources at home like fridge and stove and place to keep pots and pans, microwave, all that kind of stuff?
Yeah, it's all set up for her. I
Nice.
don't know the condition it's in because I haven't been inside. Usually I'm on the outside when I'm there. And
Mhm.
but it was all set up at least a couple months ago. It was all set up for her.
Mhm. Gotcha. Gotcha. Okay. I was just looking at Dr. Levy's notes real fast. Okay, I think those were my questions. Thank you.
Great. Any other questions from the team? Okay, Carmela, do you mind summarizing the case for us?
Absolutely. Okay, so we have a 54-year-old female with type 2 diabetes. Don't know how long for, but we do know that she has some cognitive impairment and some history of schizophrenia and hypertension. And again, this type 2 diabetes currently on 2 medications, but things are changing since in the past they were confusing. She does not currently exercise. She does live alone. She can go grocery shopping and she has some resources to support her with that, with some home-based services. I believe we heard once or twice a week. Currently not checking blood sugars. And the main question we have for this person is how do we help somebody and encourage them to have good, healthy eating habits when there's some cognitive challenges to kind of manage and work with.
All right, thank you. Moving on to recommendations, what would be your recommendations to Jill?
Some recommendations that I would have, I mean, maybe like I was stating prior, that maybe a home health person that could go in and maybe make her meals or prep some meals for her so that she would have those readily available. And maybe that would help. I don't know if a board would help where she could have like a reminder, for certain things. If someone could help her with that as well. I don't necessarily know, how it is to have a cognitive with schizophrenia, how that actually works, with remembering things or, how things should go. So, but I think maybe those things would help if, maybe she had a board that could remind her of checking things or doing things, or if someone could go in and maybe prep some meals for her so she has those readily available.
This is Jane. I was just wondering if the team is thinking about finding out what her GAF is, to find out where she's functioning at. Because that would help to know the fact is which way you can steer her. You know what I'm saying? What things, that, but it would be just, where, okay, she has some cognitive delay, but to what extent? Is she below 70, type of thing? Because I think that would just be helpful to as well. I was also thinking about a resource through NAMI, National Alliance for the Mentally Ill. They have a peer support program that is very good for a lot of people that are isolated and what have you, and that might be, and they have support groups. I even think some of them, obviously with COVID, are online now. But I think that would be a great thing for her as well.
I was thinking, Jill, you mentioned that they have all those kind of like group supports. I mean, is she's willing to cooperate with them, or she's kind of those persons that they don't want it to? I know, yes, her problems and her issues, but when someone talk to her, is she's willing to cooperate, then probably will be good just to have a group of friends, or the ones stay close to her, to give her kind of those advices, like Veronica say, kind of help her to write on things what she can eat or what she needs to eat and follow. I don't know.
Thank you.
Looks like a tough case. Jill, any other recommendations? Carmela, do you have your recommendations?
Yeah, absolutely. What some great suggestions too. And before I give mine, Jane, can I ask, did you say, what was that assessment tool to kind of help? Did you say GAFT, or I'm not familiar with that? Hope you're on mute still.
Sorry, I'm going to get this button together. Sorry. GAP, the global, and see, I know it by the thing. It's basically telling if she's, intellectually disabled, and what have you, or is, what exactly is going on. So you can know the fact is, okay, we know that we can give her 2-step directions versus 1-step directions and what have you, knowing from that. So that's why her GAF score. GAF. And I'm going to look it up right now.
I think it stands for, correct me if I'm wrong, I think it stands for Global Assessment of Functioning. Is that
Thank
GAF?
you. Right.
I'm familiar, but I don't do those, but I'm
Okay.
familiar with, because the social workers,
Yeah.
yeah, all over that.
Cool, GAF. Okay, thank you. Thanks for teaching me about that. That sounds like what a great first step, right? Like you mentioned, does she need 2-step directions, or do we need to simplify it? It's a really great point, because that along with, does she want to make changes? Because, I think probably for all of us, right? If someone just tells us we need to do this and do that, and we aren't intrinsically motivated to want to make those changes, are we usually as successful? I don't, not always. So I think along with, understanding how much we have to work with, but also kind of what does she see? And sometimes I find connecting wound healing will improve, as will pain reduction. If she's got pain, will improve with making certain food choices. Maybe eating at home for a while might be a really great time to focus on, to not have so much sodium, for example, foods, sodium-rich foods when she's eating out. And maybe that would help her. When we can connect, I can feel better sooner by making these good, healthy choices. And yeah, I think we've seen before, but I always like to fall back to the My Plate. I know that's such a simple visual for many people, and I think even I sometimes will forget about it, but it does help people to simplify things, and they visually can see it, right? So when we see this poster, whether we can print it out and let her post it up on the fridge at home, maybe, for example, it might help her to remember, again, if she wants to make these changes, if she's looking for openness to get information, that might be helpful. I always use with kiddos colors of the rainbow, trying to get different colors. Sometimes with cognitive impairment, doing things that maybe play into other understanding of other things can be helpful too. So that might be just a consideration of trying to get different colors to help her out. And then again, just supporting her with where she's at with choices, maybe checking in with her on what her beverage choices look like. Because I know, Jill, you didn't get to talk to her, so hard, to kind of get a full understanding. But when you hopefully get to talk to her, maybe that would be something to kind of just check in. Especially if she is drinking, 60 ounces of regular soda a day. There we go. That's one of our easy wins, right? That might be helpful. And And then, so I have this patient of mine who has a traumatic brain injury, and his blood sugars would get pretty darn high. And what we found was the constant change in medications with his insulin was very hard for him to remember to do it. And even just trying to remember the different names of the medications and which one he was supposed to take when was really hard. And so, Dr. Levy and I both talked about this person with simplifying as best we can, sticking maybe to, and this is one of Dr. Levy's recommendations too, is without knowing what the A1C is and hard to kind of understand what's going on, it may still be a good idea to keep to just a long-acting insulin. It may not mean we can get to ideal A1C, but if we can at least keep her out of dangerous zones, and we can keep her regimen of insulin as simplistic as we can, maybe sticking to a long acting might just be best for her instead of doing too much right at once. And he also mentioned in general, we might want to think about avoiding short acting insulin if they can't check their blood sugars. So just another consideration.
Short acting or long? Sorry to interrupt.
Say again?
Was Lantus the short acting or the long? Oh, it
Oh,
is?
good question. It's a long acting.
Okay, so she is on the long acting, but we don't know what she's being switched to.
Right.
And we don't know what her sugar is at home. Okay.
Right. Yeah. Because gosh, depending upon where her cognition is, I could see that being a challenge to remember to take it, but also what if she develops low blood sugar? Will she understand what that means and how to, yeah. And then Dr. Levy also mentioned that maybe when you are able to talk to her, Jill, is maybe to see what matters to her. Is she willing to get more help in the home or maybe live somewhere else? Or does she have other goals in mind? Are there other priorities that she has going on right now that maybe she's trying to work out? And that it might be a consideration for the person to transition to housing or increase supervision. If she does have Medicaid, she might qualify for group home waiver as an alternate living choice. And again, he didn't get to hear that she might not be appropriate for group places. But
Yeah.
I don't know. I mean, I know there are some homes that are smaller group homes. There's not as many big, a lot of people. Would she do better with that? I don't know. That's I think maybe a thought. What do you think, Jill?
I think she's a delightful lady. She's got a neat personality. So I think as a team, they're talking about she's such a liability, and I hate to hear that.
Yeah.
But at the same time, the medical needs she has are huge. This is really the team is really more for mental health, and she's got all these escalating medical needs. So they're looking at, she's a liability. But one thing she's not the first one that we feel like we're kind of stuck with. And trying to find these group homes. And so I think she might have Medicare, Medicaid. I'm pretty sure she does have both.
Yeah.
So she probably has some income and then the Medicaid piece. So if you know of places that we could call, I could have the case managers. Of course, I would talk to this person first and see if she's open to that. There just really isn't anything in Carson that I know of. What we have is more like not even like a supervised living situations. There's like nursing homes, but I don't know that I think would be too much for her. I think the smaller might work better, but it would depend on what she would be open to, because she definitely has heavy medical needs, and she's not out of control with her schizophrenia. She takes her meds as best as she can. And yeah, it's a tough situation because she does have behaviors that just like kind of most people wouldn't want to live with.
Right. Right. And like you said, maybe that's not something she would want, or maybe it is. You know, who knows? Maybe she's lonely, but maybe she likes her space. It's hard to say. I have a few people that I work with that are in homes, and I'm trying to rack my brain. I'm going to Google, here in a second once I ask you all the questions. So maybe I could try to find one. But does anybody know or are familiar with any type of smaller group homes that maybe we could recommend to Jill? I know they may not be in Carson, but maybe there's some type of network or something.
I will just say one of the things that's really hard in Las Vegas is the group home situation here. It's just very difficult. And usually the fact is that, Medicaid, but you said she might be on Medicare, are still like the funding situation is just, it's difficult. Because I know places down here are, decent places are going to want 1,800 to 2,000 at least.
Wow.
Yeah.
Wow.
That are decent, and what have you. Now, those that are running under the radar, they might take less, but then you never know. In fact, is what level of care. But I could, in an ideal world, I would see a group home, and then you have really competent staff that is able to remind her of her medication and what have you, and then the deal with the the cognitive issues as well as the schizophrenia. But hopefully, and maybe the fact is going through the National Alliance for the Mentally Ill, maybe that's a great idea. Maybe they're familiar with some group homes in the area, in Carson, or from neighboring areas.
That's great. I mean, I'm finding a list, but I don't know, it might, mean calling and kind of checking. There's an Aging and Disability Services division that came up, but I don't know what that looks like for housing. Yeah.
I just thought, sorry, Kamal, I just thought of one more thing, if you don't mind. What about the Nevada State Aging and Disability? And I think I've got it mixed up. Is anybody familiar with that? Because it covers the entire state, and they have offices all over the state. Aging, hold on for a second. I'm just gonna, Nevada Aging and Disability Service. Okay, fine. I wasn't too far.
You were on it. You got it.
I'm sorry.
You had it. You had it.
Exactly. Surprise. And stuff. But I know, they have offices all over the state. Maybe they could be, because it has, programs with, I'm just looking on this really quick. Come on, phone. Programs for persons with physical disabilities and related conditions and what have you. And I just went on their website very quickly. So might be an option.
Can you repeat the name again? I'm sorry, John.
Yeah, hold on. State of Nevada Aging and Disability Services.
Thank you.
Sure.
Awesome. So a couple of places maybe to check out, maybe see what might be available to her. It's great. Thanks, everybody.
Thank you, everybody. Carmela, so the summary of the recommendations is done according to you, or should we do it?
I'll just kind of maybe reiterate a few that we heard. So we heard a few different resources. If I'm saying it right, NAMI or NAMI, N-A-M-I for peer support. We also have the State of Nevada Aging Disability Services, or maybe checking out with some Medicaid offices to see what might be available for group home situations. And again, that being if this person is open to that, maybe that's something that they are okay with and would enjoy being with other people, to not just support her with her medications, but also with cooking and shopping. And as I'm saying this, Jill, I will also reach out to somebody that I'm familiar with who do employ people who come into the home and take them grocery shopping, and maybe seeing, because there's a group and it's just not coming to my brain. So I will see if I can find that, and we can send it to you as well. And maybe they can connect us with somebody in Carson too. But we also heard some other options, maybe some home health services can go in and help prepare meals, or maybe kind of help show her some options to choose, along with maybe a board up in her home of some options that might be really helpful for her to make some food choices at home. And then lastly, maybe having a conversation with her to kind of figuring out what is best, what are her goals and what she thinks is best for her.
Thank you.
Carmela. So Jill, as you must be aware, we will type everything out and send it to you. Any last thoughts on this case? If we have nothing, then we will move on to Carmela's didactics for today. Okay, Carmela, I'm going to pull up your presentation.
Thank you.
There you go.
All right, perfect. Okay, so I have an error there, I just realized, but no conflict of interest for today. All right, so today we're going to talk about maybe just tips, support. Maybe we could have a conversation on what we might maybe have kind of seen for other people that we've had these conversations with in regards to meal planning and grocery shopping, as well as some cooking tips when we look at the My Plate options and aligning them with the dietary guidelines. And then of course I have resources, some websites and some things to check out if you had anybody who might be interested in looking at those. So we're sticking with following a healthy diet that might kind of come in with achieving a healthy weight as well. And then next week we'll talk about physical activity. So we'll get there shortly. But we're sticking with the healthy diet, and wanted just to remind you guys of the dietary guidelines. .gov is a really great place to check out. I believe it's over 200 pages, these guidelines, with a lot of great infographics and things that you can print to kind of just help as just reminders for people and visuals to kind of help them with thinking about what they want to work on in regards to their diet. But again, what we're going to be talking about today is kind of sticking to the key recommendation number 2, which is really making choices within the food groups that are both culturally preferred, but also our own just natural food choices and what we enjoy, along with the budget that we have. As we know, everybody's budget can be different, and so sometimes that can dictate what choices that we make in regards to what we're purchasing in the grocery store and how we're able to cook things at home. And then we have some discussion too on making sure that we're being mindful of choosing foods and beverages that are limited in added sugars, as well as limited in saturated fat and limited in sodium as well. So this just is kind of our driver to help us with giving recommendations for people, but also knowing for ourselves what are some of the kind of big main messages we want to give to people. So we'll go to the next slide, please. So of course, before we go into that, I'd just like to ask you all, what do you guys see? You know, when you talk to people and maybe they've expressed that they want to make changes to their diet or their weight, what are you finding is challenging for them when it comes to cooking at home or shopping? Anything specific that you've seen or heard?
I know for my clients, this is Jane. I know for my clients, sorry, my cat keeps messing with my thing. Sorry about that, guys. That's my cat. Is it a situation of what they're saying is that even though our meals are basically delivered by the Culinary Academy, that they don't like them very often, so they go out in the community, and what do they get? Chips, soda. That's the biggest thing for my clients. I mean, the big gulps, that is life to them. So that, you know, and they have kitchens in their apartments, but because of the fact is they like the fast food and the, you know, 7-Eleven stuff, that is the biggest challenge.
Ah, gotcha. Thanks, Jane. Anybody else?
I think a lot of times it's the convenience of, being able to just go buy it and it's there. And some people just don't enjoy cooking.
Mhm.
And that's probably because they just haven't found the things that they really like. For me, I enjoy cooking, so I'm always looking up different recipes and, things to try. But I think it's probably um, the convenience of being able to just go and get it and it's readily available, even though it's not, healthy for you.
Yeah. Yeah. Great point, Veronica, for sure.
I found as well, Carmela, like the constant like stay on time, eat your meals on time.
Mhm.
If you do like if we or they do even like a 10-15 minutes walking, be constant on that. Don't do it like a I found these people like they like, oh yes, I go and I walk for 1 hour, but then they don't walk for the rest of the week.
Yes.
And how you call it, be
They're
constant on that.
consistent.
Yeah, I think that's more than anything. Is that
Yeah. Very good. Yeah, it's easy to do one thing once, right? But to keep doing it. Yep, that's the tough part. Very good. Thank you, Rosa. That's great. Jill, did you have anything to add?
Yes, this is Jill. I think the challenge that I see is that people will have, one person might be motivated, and if they live with other people, the other people aren't motivated, and it's trying to find a consensus so that there's wins all the way around.
Mhm. Yeah. You mean like people you live with at home, somebody? Yeah, great point. Great point. Yeah, for sure. Those are all great challenges though to hear. And I think it's not easy, I think, these days, right? I think we could all kind of consider for ourselves, our grandparents, our great grandparents, life was different back then when cooking was what you had to do. There wasn't options to go out to get fast food, to go to a convenience store. You had to prepare things and grow things and trade for things and be able to prepare them at home. And our world is very different today. So I think with any topic we probably talk about, I find it helpful, at least for myself, but I think for a lot of people I work with too, is not to feel pressure to change everything that maybe we have room for improvement, but maybe to ask ourselves, what is most important to me right now? What can I do realistically right now? And how can I help myself to be consistent with that? And then once I've achieved that, I can move on to something else. So just maybe something to help us all. I'm hoping to at least give something for each of you that maybe resonates and might be helpful for those you work with, but also to not expect that everything we talk about today is something that everybody should be doing, and that we want to, encourage people to do that. So thank you all for sharing that with me. I think for me, I find for a lot of people, if they say, I want to work on eating more at home, I don't, oh, you can go next slide. Sorry. Maybe they say, I'm spending so much money eating out, and I know that that's not healthy for me. And I want to, work on eating more at home. I think a lot of people get a little overwhelmed with like where to start. So I think this is always important to start for ourselves, to appreciate that there might be a 3-step process involved to support people with doing more at home cooking or at home eating. Because I think cooking and meal prepping are different, or pulling something together doesn't always have to instill a lot of cooking time. It might be just pulling something together or prepping something. So, but anyways, I like to encourage people to think about it in 3 steps. So the first one is to plan. Without a plan, we don't know what to get in the grocery store. We don't know what to pull everything together and make once we get home from the grocery store. I mean, how many of us would agree, like we go to the grocery store, we buy all these things, and then we don't have everything we need to make a recipe, or we don't know what to put together. Has anybody found that for themselves?
Me? Yeah. Honest, yes.
You are not alone, Rosa. You are not alone. I have too. So I think the first step is to ask people, you know, what do you enjoy eating? Well, and I'll talk about that here in just a second, but planning out some meals. What are some meal combinations you enjoy? What are things that you like to eat? Is it tacos? Is it spaghetti? Is it burgers? You know, what is it? Planning what meal combinations you enjoy. And then shopping, you know, hopefully using a grocery list, but essentially getting to the store and getting what you need, and then putting it together, preparing it, cooking it, combining it. So these 3 steps are helpful for people, I think, to think through. And for some, it's very intuitive and they already know this, but I think a lot of people just think they go to the store and then can come home and be successful to cook something. And that's not always the case. So next slide, please. So that planning part is, again, put to the person the question, what do you enjoy eating? Like I mentioned, is it spaghetti? Is it tacos? You know, Taco Tuesday? Is it burgers? Is it lasagna? Like if you're living with your family, what is meal choices that a lot of people enjoy? What do you guys like to have together as a family? And then find a number of meals that you want to grocery shop for that isn't overwhelming. Let me give this as an example. I have some people who eat out for lunch and dinner every day of the week, every meal. So they eat out for lunch and dinner, whether that's a convenience store, fast food, or pickup, and doing takeout. So I think the question sometimes is how many meals are you willing to cook at home and prepare at home? Should we start with 1? Should we start with 2? Don't go to having every meal for lunch and dinner or breakfast, lunch, and dinner as being something that you're going to do at home 100%, but start with just maybe 1 or 2 or 1 a day to grocery shop for. Because then that's the other thing, right? How many of us have food in the refrigerator that goes bad before we eat it? Or how many of us go grocery shopping and then we come home and say, oh, I'm too tired. I just went grocery shopping. Let's order pizza. Okay. Yeah, it happens. It happens for all of us. So let's find a number that you're willing to at least start with that isn't overwhelming. And you want to think simple, easy, doable. What is easy for me? What can I do right now? And just start there. And being that cheerleader for people where they say that's good enough. 1 meal to start with is good enough because it's moving us in that right direction. Okay, so next slide, please. So after you decide how many meals am I going to shop for and what is it that everybody wants to eat, is then to make a list of all the things that you need to be successful with that. So making a list is really helpful for many people. If we go to the grocery store without having some idea of what we want to purchase, it's going to be really challenging for people to come home with everything that they need to be successful in the kitchen. So making a list, encouraging people to shop the perimeter of the grocery store is often very helpful. It doesn't mean you can't purchase things that are in the aisles, but certainly that might be a good place to start. So we're thinking the produce area, and then we're thinking the dairy, and then we're thinking the meat area, and then the grains like the breads and the pastas and those sorts of things that might also be inside and not just the perimeter. A lot of times I hear people say, well, it's expensive and I don't, you know, I have $5-10 here and there. I don't have hundreds of dollars to spend at one time. So sometimes what's helpful is to go online or look in the paper of some coupons or things that are on sale. I know for myself, on Sundays, my meal planning time that I set aside is usually dictated by what the weekly ads look like at the grocery stores nearby me. So that kind of whatever's on sale helps me to dictate, are we having more beef this week or chicken this week, just based upon sales. And that can sometimes help people to kind of make some decisions as well. And the last thing, you know, just hearing what, you know, Veronica, you had mentioned, some people, you know, find it just better to buy convenience items than to cook them at home. Well, sometimes I encourage people to think about, there's a lot of convenience items out in the grocery store these days than ever. Like you think about prepped proteins, even for example, is more available today. Costco has chicken breast, cooked chicken breast in this vacuum sealed bag. I want to say it's like $8. You can't buy chicken that cheap anywhere else. And you can add it to salads. You can heat it up for tacos. You can add it to a pasta dish. And it's ready to go and just heat and eat. And sometimes we need some of those options to kind of help us when I don't have time to defrost and cook, but I could simply reheat and I can make this work for me. So some of those are good options. Prep salads, cut up fruits and vegetables. Those are often really helpful for people as well, as just options to kind of help add in. One of my favorite things to do on a busy night for my family is we get those 90-second quinoa and brown rice bags that you just heat up in the microwave. I add that to on the side, a bag salad, and then we heat up chicken sausages or chicken meatballs from Adele's, which is just a brand if you're not familiar with them, but it's heat, pull together, and you're done. And some people need to be given the permission that that's cooking too. That's still eating at home. And it doesn't have to be completely starting from fresh if that might be overwhelming, or they don't have the time, or they're not interested. Maybe they're not somebody who enjoys cooking. Those are still ways to do it at home without feeling like you have to cook. Next slide, please. Some resources, to help with the planning process, the grocery list process, and some meal combinations is actually on choosemyplate.gov. And these are just some pictures of some of the options that they have. So maybe someone just needs to work on planning out meals. Tonight we're gonna eat out, but tomorrow I'm gonna make spaghetti. And then the next night we're gonna have leftovers. And then the next night we're gonna do chicken and rice. Sometimes just thinking through the week can be really successful for people. But also on choosemyplate.gov, there is a My Plate Kitchen. There are recipe videos, so how you can follow along how to make things. They even have how to chop fruits and vegetables in a safe way, a lot of like basic kitchen strategies and support, along with just general recipes. So that's maybe another great place to either give to somebody or maybe to walk through it with them, and maybe pull out something that they're maybe willing to try. Okay, next slide, please. For some people who need a grocery list to start out with, maybe having a blank list that they write things down is too overwhelming. You can use something like this. I had an intern create this for me. So whenever we're talking about cooking or eating at home more often, I'll have people just circle 3 or 4 things from each group here that they enjoy and that they like, and that they can get from the grocery store. So this could be another resource if you think this might be helpful. Sometimes people just need to be given some ideas to start with, and that kind of helps them with kind of thinking for themselves what things that they enjoy. So there's that. So the next slide, please. And then my last resource that I want to share for at least this part, there's this lady, she's a dietitian and she works in public health. Her name is Jennifer Anderson. She has a website called Kids Eat in Color. And although she started out mostly working for picky eaters, she's actually developed Real Easy Weekdays. It's at $37. She's tried to make it as affordable as she possibly could. And in this, you get a lot of great recipes, ways to add in more fruits and vegetables. They're not overwhelming recipes, so they certainly don't take a lot of work. And are a great resource. I've even purchased this myself for me personally, because sometimes it can get boring in my house when I forget about things. So this has even helped me as well. So just wanted to share this with you guys too. It's just another option. I hear she's coming out with a new resource, hopefully in the next month or two, on how to feed a family of 4, on $500 a month, and some other income-based levels that are really helpful for meal combinations and meal and snack ideas. So another really great person to maybe check out. Okay, next slide. Okay, so we have about 15 minutes. So what my next plan was just to give some ideas to you. And again, you'll get the PowerPoint. So if you ever wanted to share this with somebody, we're going to go through the different food groups on here and just give some suggestions on healthy choices within that with some cultural differences in mind. So next slide, please. And as I've mentioned, the ChooseMyPlate.gov, lots of things you can just print and have and can use to support people. And people can put on the refrigerator, like I mentioned with Jill's case. But let's go first with the grains part of the plate. So that's that like orangish brown top right-hand side you can see here. So grains are going to be any food that's made with wheat, rice, oats, cornmeal, or barley as a grain. And in this section of our plate, we could either do rice or couscous or quinoa or naan bread, maybe for some Asian Indian meals. Egg noodles would fall into this. Kasha, which I'm not really familiar with, but so if anybody is, you could let us know. Or it might be a whole wheat or a corn tortilla. So whatever that's part of that meal, that's where we're going to get in that grains section of our plate. And you can see here a lot of different things that we could fit. Oatmeal would also fit in this spot, which I didn't have included in our list here. Okay, next slide, please. Fruits and vegetables. A common slogan or saying is make half your plate fruits and veggies. Sometimes that can be a simple thing for people to think about, not that it's easy to always implement, but something to think about. Half my plate is fruits and vegetables. And I want to just say really clearly that all forms of fruits and vegetables are a go, meaning we can eat fresh, frozen, and canned. Those are all acceptable forms of fruits and vegetables. The only thing we want to be somewhat mindful of is canned fruit. We want to get it canned in its own juice or water and always drain the liquid. And you can get no salt added vegetables to keep the sodium content down as well. So incorporating as many fruits and vegetables to our meals is helpful. It can be part of the grains and the entrees. It doesn't have to be separate. You know, sometimes we have apple chunks or raisins added to certain meals, like chicken salad, for example, or we've got grilled pineapple and shish kebabs is another way of incorporating fruit in with our main entree. Or it could be on the side, like a salad, for example, or a tomato cucumber salad. You know, it can be any of those as well. But I do encourage colors of the rainbow, helping people to get in as many different colors as we can. So it doesn't just have to be broccoli and cauliflower. It could be beets or watermelon and onions. It could be Brussels sprouts. It could be any of those. And again, some people may not really love all fruits and vegetables. So just encourage them to eat the ones they do love. Don't worry about trying to force people to do what they don't love, but just which ones do you enjoy and incorporating them at meals. All right, next slide, please. So for the protein section, we talked about the grains, we talked about fruits and veggies. Now we have the protein. So these are going to be foods that are made from meat, poultry, seafood, beans or peas, eggs, processed soy products, nuts or seeds. Certainly the leaner cuts of meat are always going to be better. So boneless, skinless chicken breast, beef tenderloin, for example, are all going to be really better, preferable choices. But we have from different cultures, you know, white fish to Spanish chicken to pureed beans or dried beans that we might incorporate into certain meal combinations. Or stir-fried tofu, for example, would also fit in this group as well. And the recommendation is to get a variety as well in this group, not always sticking to red meat, but having a variety of protein options is also helpful. Okay, next slide, please. So then we have the dairy group, which is kind of off the plate. It's towards, you know, the side here. This could be fluid milk products like milk, of course, soy milk. Could also be in here lactose-free milk for people who can't tolerate lactose-containing milk. But it could also incorporate foods that are made from milk, whether that's yogurt or cottage cheese or cheese, for example, in general. We do recommend low-fat or fat-free options for people. So encouraging them to choose those, like mozzarella cheese, for example, is one of the lowest fat cheeses we have. And that can be really helpful to choose those as well. Whether we're adding cheese to our entree on top, like grated cheese over spaghetti, or we have yogurt on the side with our fruit, for example, could often be part of the balanced meal as well. So all of those to construct getting in all of our food groups and choosing options within that that are healthy for us and are nourishing as well. Okay, next slide, please. So we can't ever talk about food choices without also mentioning cooking methods. And that's just because there's, of course, many different ways of cooking, but our best options are going to be baking, broiling, grilling, or roasting, or even stewing instead of frying. Frying is just going to add a lot of fat and extra calories, which can lead to increased cholesterol levels, but also lead to excess weight as well. So really helpful to choose those options instead. Certainly using a rack if you're cooking meat, or removing any visible fat that you can see and kind of trimming up, those would be better options as well. Using non-stick cooking spray or non-stick skillets, for example, can be really helpful as well to use, so that you're not having to add so much of that as well. I think the question always is when you ask somebody, how do you usually cook your meats? It can be very eye-opening. If they say they always deep fry it, that could be a recommendation of, can we try one protein meal where you bake it or broil it instead of frying it, and what would that be like, and seeing if they prefer it or if it's okay, is to kind of add in between some of those deep frying options. Okay, next slide, please. So the last thing I wanted to add in here is just labels. And we talked last week about net carbs as not being something helpful to really worry so much about. And when we're counting carbohydrates, we're looking at the total carbohydrate row. Well, the other thing that I think is really helpful to look at on a food label when we talk about health is sodium. And a lot of times manufacturers will put these words on the front of their package to kind of encourage you to purchase them, but we don't always know what it is that they exactly mean. So I have on the list here different words that might be on some of your cans or some of your packages, and some definitions on what exactly it means. So if something's labeled sodium free, it means it has really low sodium. It can't have more than 5 milligrams per serving. If it's very low sodium or low sodium, it's a reduced amount, but it can have anywhere from 35 milligrams to 140 milligrams per serving, which can still add up for some people who really need to keep their salt intake down. If it's reduced sodium, it's 25% less. If it's light, it's at least 50% less. If it says unsalted or no salt added, that's going to be very minimal. Anything that's outside of what's normally already in the food will not be there. So sodium free, very low sodium, and unsalted can be really good options for people, especially those that we work with, people who maybe have had a prior heart attack or have some type of congestive heart failure or some kidney disease. These are some people that we would want to be really encouraging of them looking at that sodium on that food label. Okay, so now I'm just going to end with just a couple more resources. This is probably one of my top favorites outside of the Kids Eat in Color resource. Leanne Brown is from New York University, and about 8 years ago, she created this Eating on $4 a Day. It's a free PDF that's available. You just Google Leanne Brown, and it's over 80 pages of healthful recipes when you're working on a limited budget. So I've had a lot of people enjoy this recipe resource, and something maybe to check out too. Okay, next slide, please. So then just a few other websites. Some people say, I don't really know what to cook. And sometimes they just need a little inspiration. They just need a couple of recipes to try out. So there's eatingwell.com. I have a lot of people that like that one. Of course, Choose My Plate we already talked about. And there's also another one called getfreshcooking.com as well. So another resource to check out. And I want to say that was it. So I'm going to stop there and ask if you have any questions before we talk about next week.
Thank you, Carmela. Great presentation. And thanks, Veronica and Jill, for your cases. Any questions on the presentation Carmela just gave?
I had a quick question, Carmela, because one of the things that, as far as for African Americans with salt, it's a huge thing. Is there any like salt substitute that actually like tastes like salt? I mean, and is garlic salt a good substitute for salt?
Great question. Great question. So when it comes to salt, any salt, garlic salt will still have salt in it. Any type of, seasoning packet, it's probably going to have quite a bit of salt in it. And so it's really helpful to look at those labels. 1 teaspoon of salt has 2,300 milligrams in it. And that's as much as we need in an entire day. 1 teaspoon, that's just not that much, right? So it's easy to accumulate these for sure. So Mrs. Dash I have a lot of people that use that and they do enjoy it. But I'm curious, has anybody else seen or heard any good salt substitute options?
I don't have any good salt substitutes, but I know for me, when I cook, if I use like different things like cumin and turmeric and garlic powder and your basils and your sage, it actually gives it great flavor. It may not give you that salty flavor, but there are different things that you can use that will help a lot. I mean, adding lemon or lime changes the way things taste. So that's what I've noticed when I cook, because I don't use much salt. But there's different things. And I mean, if you do onions or fresh garlic, that stuff gives it different flavors too, or fresh ginger and stuff like that.
Awesome. Thanks, Veronica. Absolutely. Cumin, paprika, dill, rosemary, all of those can be really helpful to kind of add to dishes. I totally agree to kind of help. But even using things like Veronica said, garlic or garlic powder or onion powder aren't going to have salt in them. So those could be some good options. But yeah, and then Mrs. Dash is another maybe one to kind of check out that I have a lot of people that use as well. Yeah. That's the other thing about fruits and vegetables. Fruits and vegetables have potassium and magnesium in them, so they can kind of help counteract the salt we have in our diet. It doesn't mean we give ourselves free permission to eat as much salt as we want if we eat fruits and vegetables, but it certainly can help and kind of supporting that, keeping that down a little bit. So. Jill, did you also have a question?
No, it's just a comment. I thought it was a good presentation. Thank you.
Oh, thank you, Jill.